I'm JJ, and this is Ivan. This video is for Diagnostics Career College, Module 203. We're going to demonstrate on how to do CPR on a dog. So you've come across a dog that's in need of CPR. The first thing that you want to get going is the chest compressions in order to get the circulation going. These first initial chest compressions should be no more than 4 minutes before you start doing the respiration breathing. Now, to perform chest compressions, get the dog laying on its side. It does not matter which side that the dog is laying on. And then to find where your hand placement is. And for a dog this size, I'll be doing two-handed chest compressions. You take their front leg, bend it back 90 degrees, and where that elbow touches the chest is where your hand placement will be. So placing one hand on top of the other, straightening your arms to be able to provide strong downward thrust. This is then a couple things with the chest compressions. You need to do them hard and you need to do them fast. So the depth of the chest compressions, because Ivan is a big chested, barrel-chested dog, needs to be about a third to a half depth of the width of his chest. And then the beats per minute is going to be 100 to 150 beats per minute. And then in between each chest compression, you need to make sure that you allow the chest to recoil between each compression. So again, this first initial round of chest compressions should not be performed for longer than 4 minutes before starting the respiration. So you come up here, and before you can do your respiration, you need to clear the airway. So you would open their mouth, check in there to see if there's any foreign body objects or dirt or vomit or blood. If there is, sweep that out and clean it up. And then you need to get a very tight seal on their mouth. So taking their lips, pulling it close, wrapping it up. And then you need to extend their head and their neck so that your air is going to go into their lungs and not into their stomach. So you would take your mouth and put it over and perform a good seal on their nostrils, and you're going to give two breaths, about a second in duration. So you would breathe and then breathe, and you're going to watch for the chest to rise. Now the rate of breaths is 10 breaths per minute. So after you've given the 2 breaths, you're going to come back here and find your hand position again. You're going to give 30 chest compressions, come back and do 2 breaths, and you're going to continue this cycle for 2 minutes before you stop and check for signs of life. And then you would continue on with 30 and 2 in 2-minute increments. And that is how you perform CPR on a dog.